This is the fourth in a series of presentations entitled The Principles and Practices of Community Building. And this specific session focuses on positive behavioral supports. And I'm Tom Pomerantz. I've struggled in terms of how I was going to open our discussion today, and I made a decision. I'm going to start this by some self-disclosure. You need to know that. By background, I was a radical operant intrusionist. Some of you may not know what that means, but I was a radical operant intrusionist. And just to give you a sense of what my background is like, number one, I got my doctorate from Indiana University, and some of you know that the chairman of the School of Psychology at Indiana University was B.F. Skinner. So that's number one. So that sort of tainted me, you know. And I have postdoctoral work from Notre Dame in the area of experimental psychology. So pretty strong. Just to give you a sense of how radical I was as a behaviorist, our oldest daughter, Amy, at 6 months gestation, that's 3 months prior to birth, I had her in a prenatal conditioning program. I took a vibrator, placed it on my wife's abdomen, because the amniotic fluid transfers the vibration, and vibration is a reinforcer for fetal movement. And I was measuring fetal intelligence prenatally based upon trials criterion, because the more trials it takes for somebody to learn something, the less intelligent you are. You know, when my daughters came home from the hospital for the first 3 months of their life, I had elastic bands on their right wrist and right ankle. And for 2 15-minute trials a day, I would take a string, tie it from their right wrist to their right ankle to a mobile above their head. Because the movement of a mobile is a reinforcer for infants. And when my daughters would go like this, the mobile would move, and they would be, you know, more likely to do this on the right side because they want to see the mobile move. So I wanted them to be right dominant. And there's a theory called Ellis stimulus trace theory that says is if children, infants, have an opportunity to engage in certain repetitive movements at a very young age, those movements correspond to establishing neurological pathways in the brain, and the child is more likely to engage in that particular movement. Thus, they would be right-handed. And I need to share something with you. It wouldn't be so bad. But if you met my 3 daughters today, they all walk around like this. I mean, it's a sad situation. I share that with you because I know often when I talk with groups, there's very strong feelings about behavior management and what that means. And I take a very different approach, and I'm going to share with you the tools that you can use. How do we need to behave, you and I, in order to help the men and women who we support improve their conduct? How can we help them behave in more socially acceptable ways? And first thing I want to share with you is behavior management, or the operant paradigm. It has a place. It does have a place. The operant paradigm has value. Operant paradigm means, you know, behavior occurs followed by a reinforcer. A reinforcer is a consequence that serves to increase the frequency and or intensity of a behavior that it follows, okay? That operant paradigm has a place. However, I think its place is perhaps in assisting individuals in acquiring new skills. You know, I can help sometimes people learn a new skill if I'm interacting with a child who has autism and has difficulty engaging in eye contact. If I reinforce the child for engaging in eye contact, I may increase, you know, by giving them a reinforcer, may increase their tendency to engage in eye contact. The operant paradigm has value in increasing productivity. You all know that. I mean, if it was announced here today that you are no longer going to get paid, I think that that would decrease the probability of you coming to work. When people tend to get, you know, more reinforcement for productivity, it tends to facilitate or increase one's productivity. The operant paradigm has value, or at least our understanding of the operant paradigm has value, in avoiding aberrant contingencies, which that means unintended contingencies. If we understand sometimes how we respond to people can inadvertently cause them to behave in socially unacceptable ways. Not that we want them to do that, but sometimes just by the way in which we redirect someone. They may find that, you know, very pleasant. They may enjoy our touch. They may enjoy our conversation. And our attempt to redirect them may ultimately result in them engaging in the very behavior that we don't want them to engage in. I recognize the operant paradigm has value. However, I think it's misplaced in addressing issues of conduct or affect. And that's really what we're going to talk about. I do not use, and again, many people approach this in many different ways, I tend not to use the operant paradigm in addressing issues of conduct, how people behave, whether it's aggression, self-injurious behavior, or property destruction. I tend not to use the operant paradigm in addressing those kind of issues. Number one, the whole basis for positive behavioral supports versus the typical behavior management, you know, where you reinforce people or engaged in planned ignoring and use token economies and all that kind of stuff. The basis of it is founded in providing people with options. And I'm going to explain this. Give people options. When people have options in their life, it enhances the quality of their life. It alters how they see themselves. It empowers people. Give people options. I also want to note that there is a difference between the word option and the word choice. If you go to a used car lot, they will never give you a car with a choice. They give you cars with options. A choice is the behavior in which you engage to select an option. Give people options. Secondly, the more competent and capable the individual, the larger the set of options you can give them. You know, I'm a pretty capable guy, you're pretty capable. I go to the grocery store and I say to myself, I want some cereal. Well, how many different cereals are there in the grocery store? Holy mackerel, they got aisles of these cereals. But you know, it's just my wife and myself, and I don't want a large family box because it'll get stale. I don't like pre-sweetened cereal. I don't like cereal with nuts and raisins in them, and I don't like cereal that is a generic brand. So I say to myself, I know what kind I want. I go, I walk into the grocery store and I can figure out what cereal I want. But as one's ability is diminished, if one has less capability, one is overwhelmed by all those options. So we must bound people's options, because the truth is we're giving people options in order to teach them how to make choices. It doesn't come naturally, so we need to restrict their options. And restricting people's options is not a denial of rights. I'm currently, my wife and I are having our house remodeled. We have a decorator. And the decorator doesn't say to us, well, what color would you like your living room? If that's all the decorator was going to say, I wouldn't need the decorator. The decorator says, well, Tom, your sofa is this color, the chair in your living room is this color, and here are some options you may wish to consider, and the decorator limits my options to 4 or 5 colors. Which one would you prefer? And I make the selection. It wasn't a denial of rights. It was the way in which that decorator was empowering me to make that decision. The less capable and competent the individual, the smaller the set of options we provide them. Bound options. Bounding people's options also assures rational protective oversight. We have an obligation. There is a covenant, in essence, that we have. A covenant is an agreement. It's an understanding. It is unwritten. But here's the covenant with the men and women we support. Do no harm. Do no harm. So when we give people options, we are obligated to restrict them in such a way that it will not jeopardize their welfare, physically or psychologically, in terms of how they are seen by others. It's a very important point. It's unfortunate that I even have to mention this, but you are aware that in some instances, staff extend options to people that cause them not to look good in the eyes of others. Perhaps in a residence, people are allowed to select their clothing, and the man leaves with a purple shirt on and yellow pants, looking more like a clown who just left the circus, and turning heads. And we need to remember something. At all cost, the men and women who we support must look good in the eyes of others. At all costs, the men and women who we support must look good in the eyes of others. It's part of the covenant that we have. So, the covenant says, do no harm. The covenant, not the person's disability, serves as the basis for denying a person their right to these negative outcomes. It's not their disability that causes us to restrict their options. It's the covenant in terms of restricting options that might cause them harm. It's an obligation that we have to them. And life. And I love this quote. It came from a friend of mine. We must provide an environment that is healthy enough for a life to happen. We must provide an environment that is healthy enough for a life to happen. And something terrible occurs when we don't provide people that kind of life. I'm going to share a word with you now. And in my opinion, it is perhaps one of the most important words in our professional vocabulary. And even though I believe that to be true, very few people know this word. This word is the basis, it is the foundation of positive behavioral support. Are you all ready for the word? The word is anomy. Anomy. And it does have an alternative spelling. It can also be spelled A-N-O-M-Y, anomy. You may not recognize it initially, but the truth is you are familiar with it. Your phone rang the other night. You ran to the phone and picked it up. There was no one there. What kind of call was it? Anonymous. No name. No name. And here's the definition of anomy. If my life has no meaning and my life has no value, I will behave in a way to cause your life to have no meaning and no value either. If my life has no meaning and my life has no value, I will behave in a way to cause your life to have no meaning and no value either. If we are able to process that, if you had an epiphany now, if the light went off, went on, you came to a recognition that perhaps the most significant intervention that we can utilize in helping people improve their conduct is to improve the quality of their life. And anomy is not something that is unique to people with disabilities. In the opinion of many contemporary sociologists, one of the most significant events of anomy occurred in this country approximately 12 years ago. 12 years ago, where there were thousands and thousands of people in this country in a given location who felt their lives had little meaning and their lives had little value, and they behaved in a way to cause the lives of other people to have no meaning and no value either. 12 years ago. And isn't it interesting, when I propose that question, people struggle with the answer. What happened in this country 12 years ago? Many of you might know, the LA riots. Now, why were the LA riots an example of anomy? Unemployment as high as 60% and people having little opportunity or hope of ever having a job. People having to live in their residences with iron bars over the doors and windows, fearful of people coming into their homes and stealing their possessions. People fearful about going to the grocery store with a few bucks in their pocket, fearful of being mugged on the way. People desperate and concerned about their children leaving home in the morning to go to school, not always sure if they would even be returning. And if anything, my dear friends, that's an understatement, not an exaggeration. And what happened? It blew up. It blew up. And if we don't understand the relationship between the LA riots and the individual you support who will pick up a plate of food at lunch and throw it across the room, you're likely to be writing a behavior management plan. And if you don't understand the relationship between the LA riots and the person you support who goes on over and bangs his head against the wall, you're likely to be writing a behavior management plan. And if you don't understand the relationship between the LA riots and the woman you support who unexpectedly comes up behind you, grabs your hair, pulls it, and won't let go, you're likely to be writing a behavior management plan. And what's the point? You can't fix a broken life with a behavior management plan. You cannot fix a broken life with a behavior management plan. When people behave in socially unacceptable ways, they're trying to tell us something. And they are not saying, give me a token economy program. They're not saying, I want a schedule of reinforcement. Give me a behavioral contract. I want non-seclusionary timeout. Anger communicates unmet need. And when people behave in socially unacceptable ways, they're trying to tell us something. They're trying to tell us something. And I share this with you in an emotive way because I spent most of my professional life trying to respond to issues of conduct, the self-injurious behavior that people engaged in, the aggression toward others, by writing behavior management plans. I still struggle with that, knowing that I did that, rather than an understanding that anger communicates unmet need. And I now want to share something with you that will take many of you by surprise. Anomy What is the cause of anomie for many of the people who we support? It is the habilitation setting generates the inappropriate behavior. You say, what? Yes, the habilitation setting generates the inappropriate behavior. The very environments that we have designed and structured because we believe they have therapeutic value. We now can step back and begin to realize that it's those very environments that are probably the cause of much of the issues of conduct demonstrated by the individuals who we support. And what did we say? Anger communicates unmet need. And when people behave in socially unacceptable ways, they're trying to tell us something. It does. You know, to call someone lazy, uncooperative, or stubborn is to admit we don't understand them. And those of you who understand this profound statement, you've got it. But how often do we try to explain somebody's behavior as, oh, he won't do it, he's just lazy, he's just uncooperative? The question is, well, why is the person not cooperating? That's the question. Why are they reluctant to expend effort in engaging in the task, which we define as lazy? Those are not explanations. They are descriptions of behavior. And they really don't even lead to a solution of how we can address the person's unmet need. Let's take a look at some of the communications that people may be providing us so that we can identify the tools, the ways in which we need to behave in order to address their unmet needs. Before I do that, I want to share something with you, and this statement is provocative, and I certainly do not mean it in any pejorative or negative kind of way, but it needs to be said. People have a right to be crazy. They just don't have a right to behave that way. That's an important point. You see, some of the men and women who we support, their behavior is driven by legitimate psychiatric issues. They may have a diagnosis of paranoid schizophrenia. You know, they may have a bipolar disorder. We may not be able to address those issues directly. The feelings that they have in their head, the voices that they hear, we may not be able to remove them. Then our responsibility then becomes teaching the person how to behave in socially acceptable ways, even though you have a compulsion to behave inappropriately. An individual may be hearing a voice or having a sensation that other people are watching them and following them and taking notes. Matter of fact, they may even feel like they're being monitored from Mars. But they don't have a right to go up to people, strangers, and put their finger in their face and yell at them, "Quit writing that down about me, you can't do that." So sometimes we have to teach people to behave in socially acceptable ways, even though we are unable to speak to the forces that cause them to behave in unacceptable ways. We must support people in behaving healthy, even though they may not be. That's an important point. Let's look at the various masks of anger. And those masks, again, are a statement of people's unmet need. Anger can be a mask for too much to do and too little time. How do you feel if you're being pushed and rushed? And hopefully you will see that each one of these then become a tool of how we need to respond to people when we sense that they're being rushed. Causes frustration, right? Expectations are not attainable. Sometimes we set the bar too high, and people have a sense or fear of failing and not being successful. Worry and sickness. Sometimes can happen to any of us. We behave in socially unacceptable ways because we have things hanging over us. We have worries, financial issues, somebody who we care about or love who may have a very serious medical issue or problem. And that may cause us issues with conduct. This mask is one of stress. The real need is relaxation, stress reduction, realistic expectations, and reassurance. Are you sure we can fix that with a behavior management plan? Do you think that we can fix one's issues of stress with a token economy program? Planned ignoring? Reinforcement? I think not. Anger can be a mask for not receiving what was wanted or expected. Some of the men and women who we support look forward to family visits, talk about them on an ongoing basis, and all of a sudden the family does not show up. People around them not sensitive to that feeling don't understand why that individual then demonstrates some significant behavioral issues, such as anger and striking out. It was that sense of disappointment. Anger can be a mask for not being treated fairly. Ask yourself, how do you feel when you're not treated fairly? Making your best effort, but not being acknowledged. This is the mask of frustration. The real need is problem solving, assistance, support, and reassurance. I want to share a thought with you. If you are a parent and you demonstrate these skills and you do them really well in your personal life, the probability is you're going to be an exemplar in your professional life. If you do these things well with your children, the likelihood is you'll come into an environment like this where you provide supports and you'll demonstrate these behaviors in an excellent way with the men and women who you support. Anger can be a mask for verbal abuse and insults. If we think about the lives many of the people who we support have had to endure, and the word endure is good, the insults they've had to experience when they were in the public schools, other children calling them names, either because of physical challenges they have or their intellectual limitations. How would any of us responded to that? And even today, the insult of going to a local shopping mall and just because they use a wheelchair, people staring at them as if they come from another planet. Anger can be a mask for neglect and humiliation. Neglect. Maybe their response is merely because they've been sitting in a Tens that are wet for 3 hours. Not because the people around them are malicious. We just weren't aware. And now the individual, because they don't have the ability to verbalize, please help me put on dry clothes or help me change my attend. They can't verbalize it, so now they start going, Are you sure a behavior management program can fix that? Anger can be a mask for depression, anxiety, and low self-esteem. You know, when people don't value themselves, what do they have to lose when other people don't see them as valued? If you don't value yourself, does it really make any difference that others don't see you in a valued way? That's why an important part of any behavioral support intervention is nurturing the idea within the people we support that they can say, I am somebody. I am somebody. I'm a good and valued human being. I am somebody. Anger can be a mask for emotional discomfort. Emotional discomfort. The real need is attention, comfort, empathy, reassurance. And finally, the last mask is anger can be a mask for being threatened. And many of our folks live in environments where they feel under constant threat. Threat perhaps of one of their other housemates or someone they receive services with who tends to act out and be aggressive. Anger can be a mask for being physically hurt. You know, the individual has had a history, requires 2 people to assist him in transferring. And though it was a number of years ago, he was dropped on 2 occasions during the transfer. Staff don't know that. But when they assist him in transferring, frequently he'll start going, ah, 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 ah. What's he saying? I'm fearful of being dropped. Please don't drop me. You see, I can't verbalize to you what has happened to me. But I'm expressing my unmet need. You need to assist me in moving in such a way that I have a high level of assurance and security. Maybe this wouldn't happen if you got a Hoyer lift and it would help me feel more secure and 2 people weren't trying to transfer me. Anger can be a mask for the threat of loss of love or attachment. How many of the people we support develop valued relationships with the people who support them, either in their residence or a day program. They wake up the next morning, and that staff who had been there for 10 years is now gone. They don't understand why. They don't know where. They're gone. They've been in a day program for many years. The staff who support them disappear with no ability to understand why. How can we connect if we're always living under the constant fear that those we have connected to will no longer be there? This is a mask of fear. The real need is safety, security, reassurance. Have you ever heard someone say, he had a behavior? He had a behavior. Have you ever heard someone say, I've heard him say he's had a behavior. And the answer is, of course, he had a behavior. You have to behave until you're dead. We all behave. Right now, I'm behaving. You know, there's talking behavior, there's walking behavior, there's smiling behavior, there's sitting down behavior. Have you ever looked outside and not seen weather? Well, there's always weather outside. There's rainy weather, you know, sunny weather, cold weather, hot weather, foggy weather. A person always must behave. They must behave. And sometimes we fail to put an adjective with that behavior. Self-injurious behavior, aggressive behavior. But it's not a matter of eliminating behavior. It's a matter of teaching people more socially acceptable ways of behaving. The question, what's the question? The question is as important as the answer. Our effort to resolve challenges that erode quality of life is a statement of how much we care. When we see people who demonstrate behaviors that erode or serve as barriers to a quality life, and we take no action, it is a terrible testament, it is a terrible statement regarding how we feel about that person. My point is, we may not have the answer. You know, the people with the greatest expertise in this country may not have the answer to always support people in behaving in a more socially acceptable way. It's our effort, the attempts that we make to support them, that is as important as the answer. Not having the answer is forgivable. Failure to ask the question is not. We must do something even if it is wrong. I'm not suggesting that we make the issue worse, but we cannot be in the lives of people who have significant behavioral challenges and do nothing. We must do something. And you all know why. Because it is how we would wish to be treated. If you were the person who was engaging in hand-biting behavior, you were the person who was engaging in head-banging behavior or running constantly out of a room without supervision or support, you would want somebody to intervene to allow you to behave in more socially acceptable ways. When behavioral issues adversely affect quality of life, initiate intervention expeditiously, creatively, consistently, and sensitively. Such action communicates that we care, empowers staff, enhances clinical skills. You know, the more we attempt to support people, the better we get at it. It demonstrates empathy. That's how we would want to be treated. It provides protective oversight, achieves regulatory compliance. I mean, regulation in and of itself expects that we keep people safe. Do something, even if it's wrong. You know, there's a word, and I think many of you may be familiar with it. The phrase is, actually it's two words, nosocomial infection. And I have a hunch, many of you have heard those two words, nosocomial infection. And it's almost counterintuitive, because a nosocomial infection is an infection that is acquired in a hospital or a therapeutic setting. So I have a terrible pain in my stomach, and I go to the emergency room and they diagnose that my appendix is inflamed and I have to have an appendectomy and they've got to take it out. And I go through the surgery and they take it out and I develop an infection on the surgical site. That's a nosocomial infection. So they put an indwelling catheter in to drain the infection. I get a secondary infection on the catheter site. That's nosocomial. I'm lying in bed. My fever is rising because I have this infection. And I can hardly move. And I develop decubitus, which is ulcerations on my hind side because I can hardly move. That's nosocomial. Now I can hardly move. My fever is rising. I develop pneumonia. My lungs are filling up with fluid because I'm so sedentary. that's nosocomial, and I die. All because I was admitted to the hospital with appendicitis. And it's counterintuitive, isn't it? You go someplace in order to get better, but you end up getting sicker or perhaps even dying. Nosocomial infection. You ready for this one? Nosocomial behavior. And what is nosocomial behavior? Nosocomial behavior is the challenging behavior acquired in an institutional environment. Now remember the definition of an institution. An institution is not a place, it is a state of mind. An institution is not a place, it is a state of mind, and nosocomial behavior is behavior that is acquired in an institution as a result of active treatment services. And I normally don't use the word active treatment. I'm sure many of you who have been through many of my sessions never ever have heard me use the word active treatment. I'm using it in this context. But active treatment is supposed to be something that is curative, that is supposed to improve quality of life. Well, what does active treatment mean? And how can active treatment cause nosocomial behavior? I'm going to put them all up here at one time, and here it goes. What is active treatment? Active treatment, people normally define it as providing token economies, behavioral contracts, menus, having some unseen face from a far-off land with the RD initials after their name, telling people what it is they need to eat. Programs. I thought you're supposed to program computers, not human beings. Habilitation, placement. Placement. Being a priority on a community placement waiting list is not seeing the light at the end of the tunnel. It's standing on the edge of a precipice. Placement, by its very definition, the person loses their right to decide where they're going to be living. They're being placed. Schedules of reinforcement, planned ignoring, behavior management, activity schedules. That is the grist, that's the foundation, that's the essence of active treatment. And I contend it is those things that more often than not give rise to the behaviors that undermine quality of life, because these all have one thing in common. They are controlling. A controlling do-to mentality drains the life out of its subjects. So what does that tell you about positive behavioral supports? What does that tell you about how we need to behave? Well, what it tells me is we've got to give people more control over their life. Give them more control, not less control. And isn't there an irony when people behave in socially unacceptable ways? Our first response usually is to put more controls over them. So the person behaves in inappropriate ways, and the next step is we perhaps will restrict where they can go and who they can interact with, and that doesn't work, and their behavior gets worse, and then we put more controls over their life, and their behavior gets worse, and we put more controls over their life, and it keeps going. We even have a name for that, by the way. It's called hierarchy of intervention. So the more inappropriate the person becomes, the more we turn the screws. And the irony is, the arrows are going in the wrong direction. Because when people behave in socially inappropriate ways, we need to give them more control, not less. More control, not less, if you believe that their behavior is a function of enemy. If their behavior is a function of enemy. I want to share something with you. It's one of those little stories that may give you a little insight in terms of how you can use the tools. I do a lot of consulting and working with agencies who serve people who are very, very challenging, either very aggressive or self-injurious. And I received a call not too long ago at this agency where they were serving a woman who had cerebral palsy, had quadriplegia, movement in all four extremities, very, very limited. She uses a wheelchair. And the problem was, for the last 2 years, she had increased rates of hand-biting behavior, self-injurious behavior, biting her hand. And the agency didn't want to use intrusive procedures to help her, so they reinforced what is called oppositional behavior or antithetical behavior. The idea was if you could reinforce her for putting her hand in the down position, her hand couldn't be in her mouth. So they got these jelly bean switches, the adaptive switches. They call them jelly bean because they're usually red. And they attached it to a number of items of preference. A back vibrating cushion, put it very close to her so she could reach out and turn the back vibrating cushion on. A seasonal affect lamp, because they thought she might like the warmth of the lamp and she could put her hand out and turn it on. Stereo headset, all these kind of devices. And that's not intrusive. It wasn't intended to be aversive, but reinforcing her for putting her hand in this position. And they continued that way for these 2 years, and the behavior continued to get worse, and then she started to bite her other hand, and they finally got to the point that they had her in double-arm tubes because her hands were constantly infected from the saliva and biting and open sores. I get a call. I come to meet with her. The woman's speech is such that I can't understand a word that she's saying. She uses a wheelchair. I sat down in front of her and sat in the chair talking with her. Took the double arm tubes off because if she started to bite, I could always redirect, and block her. And I'm talking, not that she understood a word that I said, but as I was talking to her, all of a sudden, I don't know how to describe it, other than she acted as if she was possessed by a demon and the sounds came from the bowels of hell. All of a sudden, she went, "Ah!" And I'm watching her, and I take her arm to bring it down, and you could see that her whole body became taut like this. And I said, "May I feel your leg?" Not that she would understand me, but just watching her. And I reached over and felt her leg. That was the feel of her leg. She was having an intense muscle spasm, a cramp. You ever had a really bad Charlie horse at night? Imagine having a Charlie horse at night and having cerebral palsy, and you can't move your arms any further than this to rub it out. Imagine having the cramp and you can't walk, so you can't stand up to walk it out. Imagine having that Charlie horse and you can't verbalize to anybody what is wrong because you lack the ability to verbalize. And now I want you to imagine having that Charlie horse 125 times a day because you're relegated to a wheelchair where you're so poorly positioned and your body's so poorly aligned that it's constantly going through muscle spasms. Now imagine having those Charlie horses and receiving services from an agency where they have a psychologist that is writing behavior management plans to reinforce you for not screaming and biting your hand. What is the woman telling us? What is her unmet need? She's saying, can you please have the physician write an order for a prescription, a muscle relaxant so I don't cramp? Can you please have the physician write an order to have the physical therapist do range of motion exercises with me 2 or 3 times a day so my muscles are less likely to cramp? Would you please have the physician write an order so the PT can assess my wheelchair and I can have inserts and be more appropriately aligned in this chair so my body doesn't cramp? Anger communicates unmet need. We need to listen. We need to listen. I'm going to give you a suggestion on how we can identify these unmet needs. I don't always share this, but here is the suggestion. It is found in these glasses. This is a very special pair of glasses, for they contain a lens that when I look through the lens and I look at the men and women who we support, I now see me. I see me. And when you put these glasses on and you see yourself in the individuals who we support, the unmet needs will come to surface. You'll see the struggle that somebody has trying to leave their day program room because of the threshold that is there that makes the room less accessible and the frustration they now feel in trying to get out of that room by themselves because they can't. The intervention is clear. We need to alter the threshold. The glasses. You will see things you have never seen before. I know some of you have been mushroom hunting. And people usually, when they go mushroom hunting for the first time, usually don't go by themselves. And the first time I went mushroom hunting, I went with my friend James in North Carolina. And James and I are in the forest, and I come out with my little wicker basket. What do I know about mushroom hunting, right? You know, hold about 50 mushrooms. And James come out with one of these big bags on his side, holds 150 pounds of mushrooms. And we're standing in the forest. And I'm looking around, and I don't see any mushrooms. James, I don't see any mushrooms. There are no mushrooms here. Tom, there are mushrooms everywhere. They're everywhere. Tom, look at that oak tree about 25 yards out. Look on the north side, the left side of that tree where the moss is. Follow your eye all the way down to the bottom. James, you're right. I see mushrooms right at the base of that tree. That's right. James, I don't see mushrooms anywhere else. That's it. Tom, I said there are mushrooms everywhere. Look straight out. Those boulders, 3 boulders, 20 feet out, straight out. Look where the leaves have blown up against the boulders. Look in front of the leaves. You know, James, you're right. I see mushrooms right in front of those leaves. There they are. Hey, James, look at that along that path where those ferns are. Between all those ferns on that path, I see mushrooms all along there. James, look over there where the tree line starts, where that field comes to an end and the woods begins. I see mushrooms along over there. Guess what happens? The whole forest fills with mushrooms. It's the lenses. If you're going to provide a good job in terms of behavioral supports, you've got to identify the unmet need. And I now want to give you a maxim, a wonderful phrase that I hope you will keep with you. And here it is. When you change the way in which you see things, the things you see will change. When you change the way in which you see things, the things you see will change. So once you put these glasses on, you will be in a position to identify the unmet needs of the people you support. You will be able to make the connection between those needs and issues of conduct that they're struggling with. I want to do a little segue now and share with you the concept of cooperation, because more often than not, we have concerns about the struggles that we have with people who we support. I use the word struggle, by the way, our struggles. Let me share one with you. If you make it a struggle, you will lose. If you make it a struggle, you will lose. I see a parent in a shopping mall with a 4-year-old, and they're in a struggle. Not only are they in a struggle, they're losing it. How can you lose a struggle with a 4-year-old? All you can hope is that parent doesn't work in our field, right? They're in a struggle. If you make it a struggle, you will lose. It's an important concept. How do we gain the cooperation of the people who we support? These are important tools I want to share with you. Gaining cooperation. People who behave in a resistive manner are communicating their unmet needs. To gain their cooperation, we must address those unmet needs. I want to be valued and appreciated by others. If we value each other and bond, I will be less likely to behave in a way to disappoint you. By bonding with people, they are less likely to behave in a way to disappoint us. I can't prove it, but I believe it to be true. Bond. And the way in which I bond with my children is different than the way I bond with my wife, is different than the way I bond with my best friend, is different than the way I bond with my colleagues. You are all professionals, but we bond. And the way in which we bond is influenced by our role and position, but we bond. It's a statement to that person is, I value you. And you've all heard some staff members say, I can't get Bill to do anything. But Susan, boy, she'll do anything for him. It's not magic. It's bonding. And gaining cooperation, I need a sense of control over my life. If I'm not allowed to self-determine the essentials in my life, where I live, what I eat, my daily schedule, I fulfill my unmet need to self-determine by refusing to cooperate. The staff says, we can't get him to take his medication, Tom. He refuses to take a shower. He won't get up in the morning. People control what they can control. The need to exercise control over your life, in my opinion, is one of the most powerful influences in life. And yet so many of the men and women who we support are stripped of opportunities to control their life. So when people do not cooperate, one of the things you want to look at is how can we give that person more control over their life, not less. I will control what I can control. You know, sometimes somebody will say, I'll hear someone say, it's attention-seeking behavior. He's doing that for attention-seeking. Attention-seeking. Let us never say that again. When people have lives of little meaning and value, and we're explaining their behavior as attention-seeking, there's something the person is seeking, all right. Can I tell you what I think they're seeking? Prestige. Prestige. I'm a good and valued human being. The woman who is biting her hand and uses the wheelchair, it's not attention she's seeking, it's prestige. She says, care about me enough to do something with my muscle spasms. Treat me as a good and valued person. Gaining cooperation. The need to be in control of one's life is all powerful. People will control what they can control. People will engage in counterproductive behavior to exercise their need to control. Can you identify when the need to control is an unmet need? And I can't even begin to tell you how commonly I see this as the explanation for people's refusal to cooperate or acting out a need to have some control over their life. If I'm going to cooperate with you, I need to know what's in it for me. Bring to my attention why I should engage in the activity. If I engage, will it show others how strong, talented, or capable I am? Tom Sawyer understood this. You got that one? Remember Tom Sawyer in whitewashing the fence? He got his playmates to end up doing it while he went fishing because he got them to believe there was something in it for them. You want people to cooperate? Well, what's in it for them? Either it needs to be something intrinsic, the joy of doing art and having other people celebrate the work that you've done, or maybe you don't even like art. But the fact that you get $5,000 a portrait, it may be enough for doing it. What's in it for the people who we support? When you touch me, it is purposeful, assisting me in my daily routine, transferring or walking, providing physical prompts. If you touch me, only when I require assistance I will learn to resist your touch. Touch me non-contingently. Touch me because you see me as a good and valued human being. If you only touch me for your purposes, I am more likely to resist your touch. I really believe that a very high percentage of individuals who have a diagnosis of tactile defensiveness, now called tactile selectiveness, really don't have it. That's a neurologically derived or based condition. I don't think that's the issue for a very large percentage of people. It's not tactile defensiveness. They're saying, get your hands off me. I'm tired of you touching me only for your own purposes. Gaining cooperation. It may not be obvious to you, but what you are asking me to do requires a lot more physical and or cognitive effort than I'm used to exerting. If you lower the bar and are willing to take what you can get closest to what you want, I will probably cooperate. Let's engage the person at the level at which they are willing or capable of cooperating. If Mohammed won't go to the mountain, you bring the mountain to Mohammed. The man won't stand up to take his napkins and paper plates to the wastebasket. Don't make it a struggle. Bring the wastebasket to him. Get people to cooperate. Look at this. Give them the hook. Give them the hook. It takes two things. Two things to be a really good support staff. I'm not going to say a word. Just watch me. Doesn't require either of those to provide direct care. You empower people because you've got this and you've got that. And finally, there are activities and routines which you ask me to do that may cause me to be anxious. Get to know me and become familiar with my history. This will help you to be more sensitive and understanding in my effort to cooperate. You may not understand why I'm so reluctant to take a shower. But if you knew my history, you would understand. More often than not, they put me in cold showers, and it was terrible. You know, and I don't have the intuitive ability to really understand that that won't happen anymore. Are you listening to me? I'm saying, please be sensitive. Thank you. Have a good day. Bye. Thank you.